are ready.
This is Brewing Better Health, a series from the School of Public Health at the University of Nevada, Reno, where every cup sparks connection and a healthy conversation. Join Dean Muge Akpinar-Elci each month for a cup of Turkish coffee as we pour insights into public health. Today, we take a look back at the first 6 months of Brewing Better Health and reflect on some of the fun, the stories, and the insights that have been shared with Dean Muge. Stay tuned to the end to see how the Turkish coffee gets made.
She needs to clap, and we need to start really slowly. So
I want to clap board.
we will. Yes, exactly. I want a clap board actually. I want to be professional. Just drink, actually. You can drink, really.
Do we cheers at all or no?
No. So, why we really doing it this, actually? I want to ask you, because it was your idea, and how you come with this idea.
Well, I think one of there's lots of things I love about our School of Public Health, but I think in working with you and for you, I think this leadership and vision that you bring, but is also this piece of culture that you bring to it, and how you've shared Turkish coffee with others and this ritual. And there is this connection. There's something very special that happens over this. And I've been fortunate to get to enjoy Turkish coffee with you.
I think it's really, really fascinating just to be able to sit down, to enjoy the moment, to enjoy connection, and just to take those few moments. I think we need to do that more. So thank you for that opportunity to be able to just sit down, relax, have a conversation, and enjoy this new experience.
What do I do?
A lot of things. Picking and stuff is tough, but
I am a behavioral scientist, so I do my research from the perspective of somebody who thinks about culture and society and behavior. And then I use this public health lens that helps me think about systems and structures, all in a very kind of applied and pragmatic way to understand the factors that produce harms related to drug use, and then how we can intervene to reduce drug-related harms.
But could you please talk about what you do really now?
Yeah, so
because clinical to move to this side is different.
The side of it is. So medicine definitely deals with that individual. Public health deals with the community. So it's a doctor sees one person, I try to see 1,000 people. On those points and stuff. So anywhere there's very specific stuff, and public health is broad. There's a lot of stuff we do. So people know it as our restaurant inspections. We also deal with land and wells and swimming pools and hotel rooms, and also disease surveillance. We have over 88 diseases that we try to track.
Everything.
School health, immunizations, and so we have a lot of points in the community that we really are the ones to measure that and make sure that we look for trends that make sure to keep us healthy. And can we make an intervention then?
We're so used to working with big data sets, we can forget that those entries in the data sets are people.
Yes.
And anytime there's an opportunity to sort of kind of humanize what we're doing and remember, yes, these are families, I think that's very valuable.
A lot of times we have patients, and some people might say, well, if you just tried harder, if you just did better for that back pain or that wound or whatever you're treating. But if you really look and listen, it could be more of a public health. Maybe a transportation is the reason they can't get there. Maybe it's their housing. Maybe it's their diet or food. There could be so many other things why this person that walks to your clinic is not getting better.
I really truly love what I do. I believe in what I do. I believe in our mission as the School of Public Health. I believe that we can encourage, inspire, and make an impact. I do think that it's hard. There's hard times. There's things that we're up against. But I believe that it's an important. I've seen it in my work with the students. I've seen it in my work with the community, that it's needed. And that when we do things, when things are happening and learning is taking place and people are exposed to what is public health, what it truly is, what does it mean, that good things happen.
One, even if you are fortunate and a very healthy, robust person, I think there's value to clean air. We live in a beautiful part of the country. I like to look out my window and not just see the city, but see the mountains behind the city, you know, and I think there's value in that. And then, of course, there's value from the health standpoint, too. I mean, going outside and exercising or going for a walk and breathing clean air, it's healthier for you, it's more enjoyable. And it's, I don't know. I just think there's a lot of benefits to it. And then there's the whole climate change that we haven't really talked about too. But many of the pollutants that we're worried about are also greenhouse gases. And climate change also has consequences, right? I mean, more wildfires, bigger wildfires, more hurricanes, stronger hurricane. I mean, there's like flooding. I mean, there's a lot of things that impact health that way too. And maybe, you know, we're not as worried about some of those issues here. We're worried about the fires a lot. We're not worried about hurricanes in Reno. But other people have
in
other
the East
things.
Coast,
Exactly.
the whole life is the hurricane.
Exactly.
Watch the hurricane. We are really focusing here who we are as a people.
Yes.
I really want to make the public health more humane, you know, just to feel more humane side of the public health. Because all of us, we have very ambitious about what we do in the public health. It's all kind of very passionate and just driven people in public health.
Right.
And I really want to give that perspective, who we are as a human, not just, again, lecturing to don't do this, or do this. It's not. This is conversation. Everything is the connection, how we can make to that relationship and how we can build to that trust around us. So this kind of support system is so important. And with the public health also, you know that what we are trying to do here is just more how we can support our families, our communities, our neighbors to make it more healthier, better world, actually, in a sense. Many people, they call us dreamers, but we believe the dreams, I guess, made a sense.
And you're right. They may say that we're dreamers. They may say that we have our, heads in the clouds thinking about saving the world. But why not? Why not want to promote health? Why not want people to live healthy lives and encourage them to be the best person that they can be?
Exactly.
Why not have experiences where we are taking care of ourselves, our bodies, our minds, that we are looking at all the dimensions of health and we are deciding that we want to be our best in each dimension. So if that's being a dreamer, then I will be a dreamer. Dream on. I will be a dreamer.
Yes, go on.
I might.
That is totally a safe place. I say that coffee is really just for the be in the moment, listen each other, and again, we have time.
Yeah. Every time somebody that I know dies of a drug overdose, I question everything, right? Is what we're doing the right thing? Does it make sense? Should we be doing this differently? It's not working? Are we failing? Am I failing? And I go through this cycle because in the field, when you do this work, like, you know a lot of people. And over the past many years, we've had a lot of people die. But then I'm able to pull myself out of that, usually because I talk to my staff and I sit at our field site and I talk to participants in our research studies, and I remember that there are a lot of people out there who are living much better lives than they would have. And there are a lot of people out there who are alive because of the work that we're doing. You know, every time somebody dies, it's such a big loss. And so we think about that, but then we have to pull ourselves back to remembering all the people who are alive because of the work that we've done. And when you sit at the field site and you talk with people, they come in and they say thank you. They say thank you for doing the work you're doing. Thank you for treating me the way you're treating me. And that happens, that happens a lot.
You tell me that also it was very excited moment for you because also we are creating this program under the public health.
Right.
Can you talk about the why?
Right.
This
So
is interesting for
public
you.
health, an umbrella with the physical therapy, plus in addition is an R1 university. So now all of us can work together to do that preventive things we mentioned a little bit earlier. We can work together on all the big research projects our community needs to know to produce what we call evidence-based care, and then help prevent some of this stuff. So in a school of medicine or other departments, the focus really is on patients
clinical.
and one-on-one clinical. And if I do research, it's like a randomized clinical trial for those patients. Here, we look broader, which is really exciting, so we can then make an impact on our state.
You know that nowadays we have a lot of distrust to public health.
Yeah.
So what do you feel about what's happening?
Distrust is just an opportunity to educate, and being transparent, and let's have the conversations, not avoiding them. And, it's re-earning trust or point. Well, perhaps it was never earned, but just being able to explain it. So that's part of what we need to do as a community is sitting down and having the conversations. Because if you don't have it, then...
And listening to
and listening, and really listening where the point is and stuff. And so sometimes we get a little bit lost in that, because we're advocating and we make an impact on our community, but we also need to listen to everybody.
We're scientists, right? And so we are supposed to ask questions and then conduct research to answer those questions, and science moves incrementally. And so sometimes, so we question our results. Things evolve over time. The field moves, and that is part of doing the work. But especially in challenging times, and when lives are at stake, that uncertainty can be hard. Certainly in the work that we do with people who use drugs, the illegal drug market is so unpredictable right now, right? It's so volatile and it's so dangerous. From day to day or week to week, people don't always know what's in the drug supply, and that's new. It didn't used to be that way, right? And so even talking to people who use drugs about that level of volatility and uncertainty, and how do you do your best to protect yourself in the moment, knowing what you know, but also knowing that there's uncertainty, I think that's one of the fundamental challenges of public health, right? How do we how do we do the best we can do and protect the most people with the fewest harms, given the uncertainty that always exists?
People have to rely on authority because they generally, not always, but often don't have the toolkit to understand it themselves. I mean, I'm an expert in epidemiology, and in that little narrow slice of the world, yes, I have the tool. I can understand it, right? But the whole rest of the world, I don't have that training. I have to rely on other people. And I think that who the authority is and who's trusted has changed a lot over the last several decades. It used to be that everyone in the community got the same newspaper, and the news channels had basically the same story. You just chose the anchor man you preferred. And now it's so different.
You can get your news from anywhere.
Anywhere. And when people lack the toolkit to really decide for themselves, which it's not really reasonable to expect that they would have that, I think you end up with this really fragmented kind of, everyone has their own person that they turn to.
I don't know if a lot of people know, but we are the third from the bottom in the number of physical therapists per 100,000 people. Fifth
As a
fastest
state.
as a state, fifth fastest growing area. But all of those statistics get a lot worse once you go rural. So we need to look at graduating physical therapists that will stay here and live here. The unique thing about the curriculum is designing what I call a good primary care physical therapist. So when you go out to the rural area, you need to see that person who walks through the door that might have a stroke, to a knee problem, to a shoulder problem. That's what the rural folks have been telling me. When we're here in Reno and Sparks and Carson City and in this area here, I've been an advocate of not only graduating great baseline physical therapists, but then establishing here, which there's none, residencies. So if they want to be a board certified expert in something that's really needed here, they can do that. So a lot of the hospitals and clinics are interested in doing that, but our job is to do great entry-level physical therapists.
So, let's start again. Seema, thank you very much for joining me today.
Thank you for having me. This is such a treat.
Thank you. And just that today you will learn also how to do the Turkish coffee.
Yeah, okay.
And we measure with the cups, you know, how many people drinking the coffee. We put that much water. Water needs to be cold, you know, just we will start the brewing. And because we will brew the coffee, not just cook the coffee.
Okay.
And boiling is not a good thing for the Turkish coffee. You cannot boil it, you will brew. Each person gets 1 spoon at least. I do a little bit more for us. You can have your coffee with sugar, without sugar, semi-sweet, sweet. How do you want to take your coffee?
I'll do a little sweet.
Little sweet. And whole key is you mix it before putting on the fire, on the stove. And after you will never touch it because everything is the foam. You need to have a foam. And you need to catch the foam. Otherwise, it will boil and just you lost the foam.
Oh, okay.
Everybody gets equal amount of foam.
Yes.
And
If
that's
you
it.
don't, then I am not a good host. That is the point. Or I don't like you. But I will have a foam for you. Don't worry.
Well, I'm glad I got some foam. That means that you actually enjoy it.
I really like you. But do you know why we picked the Turkish coffee for this?
I don't think so, no.
You didn't watch the other shows. Whole idea is how we can socialize, how we can talk. And it's very safe space, you know, just because in that moment you are really focusing the moment, listening to each other, and you lost time.
Yeah.
That is the whole idea.
This is why you ask us to coffee when you really want to talk.
Exactly. And be in the moment and just focus. Everything is the more tradition, because this is ritual. Do you have that kind of ritual in your life to have to pause or?
I think I have that relationship with exercise. I have that relationship with weightlifting. I think weightlifting is a practice.
That is
You have to be present.
So you don't get to a boil, but you get enough that it just hits the foam.
foam. That is the part.
That's awesome.
Because it needs to settle, so it needs to go out. Seema, you are getting money.
What?
Big money.
Is that what that is?
Yeah. Just like a coming.